We need to talk about anxiety because, well, it feels terrible. Feeling worried or on edge can be absolutely exhausting, and I know from first-hand experience. But there's nothing wrong with you. It's just a condition that needs to be diagnosed, understood, and managed. And today I'm helping you do all of that. So let's talk about anxiety. If you're new here, or just as an introduction, I'm Jeremy Godwin and I live with anxiety. It's something that became really bad for me in late 2011 when I had a total breakdown and I could barely function. The next few years after that involved quite serious depression and anxiety, and although I managed to overcome depression a few years ago, thankfully, I still live with mild anxiety now. I'm less thankful about that, but hey, at least it's less severe than it once was. Anxiety is something I've actually lived with for most of my life. It just took a breakdown for me to actually realize it. So that's why I make these videos on YouTube and why I do my podcast, Let's Talk About Mental Health, so that I can help other people like you find healthy ways to cope with and manage their mental health. Now, I will say up front that it's taken me a lot of time to learn how to live with anxiety, and it begins with understanding it more, and so that's what I'm focusing on today. So let's talk about what anxiety is. The word anxiety broadly refers to a feeling of worry, nervousness, or unease about something with an uncertain outcome, and that comes from the Oxford Dictionary. In psychology, however, it's a broad term used to describe nervous disorders that are marked by excessive uneasiness and apprehension, typically with compulsive behavior or panic attacks, and again, that comes from the Oxford Dictionary. So we tend to use the word anxious as an umbrella term for feeling stressed or worried. But anxiety is much more than just those feelings. Depending on the type of anxiety that you're experiencing, you might feel overwhelmed by issues or even by day-to-day matters, or you may find yourself being plagued by constant worry about the future, or find it difficult to stop ruminating over past events or actions. So let's talk about the most common types of anxiety, and I'm going to draw from an article by Beyond Blue for this, which you'll find linked in the description below. Starting with generalized anxiety disorder, also known as GAD, where a person feels anxious on most days, worrying about lots of different things for a period of 6 months or more. Social anxiety, where a person has an intense fear of being criticized, embarrassed, or humiliated, even in everyday situations, such as speaking publicly, eating in public, being assertive at work, or making small talk. Specific phobias. This is where a person feels very fearful about a particular object or situation, and they may go to great lengths to avoid it. For example, having an injection or traveling on a plane. There are many different types of phobias. And panic disorder, where a person has panic attacks, which are intense, overwhelming, and often involve uncontrollable feelings of anxiety combined with a range of physical symptoms. Someone having a panic attack may experience shortness of breath, chest pain, dizziness, and excessive perspiration. Sometimes people experiencing a panic attack think they are having a heart attack or are about to die. There are other types of conditions where anxiety can be present as well, such as obsessive compulsive disorder or OCD, and post-traumatic stress disorder or PTSD, to name just two. So, what are some of the common symptoms of anxiety? Well, according to the Black Dog Institute, they can include some or all of the following. Feeling very worried or afraid most of the time, feeling tense, on edge, nervous, or scared, feeling irritable, agitated, or panicky, or feeling as though you may vomit. You might also experience difficulty sleeping, trouble concentrating, and physical symptoms like stomach aches or a churning feeling in your gut, lightheadedness, dizziness, trembling, sweating, or even excessive thirst. These symptoms on their own don't necessarily point to anxiety, but when there are multiple signs present, then it may be anxiety related. The thing is that for a lot of people, anxiety shows up physically before there's even an understanding that something's going on emotionally. Before my own breakdown, I had quite a lot of severe stomach issues, and it was only when I told my doctor I'd been dealing with excessive stress at work that we started exploring all of my symptoms and realized it was actually anxiety and depression. So please be completely open and transparent about everything that you've been dealing with when you speak with your doctor, because it makes it easier for them to diagnose your situation correctly. Speaking of depression, probably the main thing I want to highlight here is that it's quite common for people with anxiety to also experience depression, or for people with depression to also experience anxiety. It's not the case for everyone, but they do often go hand in hand. And so again, if you're experiencing symptoms of either or both conditions, then it really is best to go and speak with your doctor and discuss your situation. So let's talk about why understanding anxiety matters. And it matters because symptoms very rarely just go away on their own. And for many people, they can actually become worse over time if not addressed. To give you a broad perspective of just how common anxiety is in the world, here in Australia, it is the most common mental health condition. And on average, 1 in 4 people, 25% of the population, will experience anxiety at some stage in their lives. Those numbers will vary slightly from country to country, but in general, it's a lot of people dealing with this stuff. So if this is any comfort at all, you're not alone in experiencing ongoing anxiety symptoms. On behalf of all of us, hello and welcome to the club. Understanding anxiety matters because it's about having awareness of your situation so that you can make changes and then take action to address it, since it's very unlikely to just magically resolve itself. The way I look at it is this: anxiety is a sign that something needs to change. Whether that's in terms of your health, physically, emotionally, mentally, spiritually, socially, or financially, or more broadly to do with your work or your relationships, whatever it is, anxiety is telling you that you need to do something different. Let me clarify here that anxiety can be caused by a number of factors, either internal or external or both. And so it's rarely ever just as simple as saying, oh, I'm anxious because of my job, or it's my physical health issues that are making me feel anxious. Yes, it can be caused by a specific disorder like GAD, but the actual feeling of anxiety or worry or whatever is just one symptom of a broader condition. So again, it's important to have a proper diagnosis. And that means from an actual doctor, not from Dr. Google. And to develop a deeper understanding of where it's coming from for you so that you can work through it. For many of us, when we're feeling anxious, we might find that we have lots of nervous energy and that we feel tense, both physically and emotionally. And that's just a physical manifestation of what's going on inside your brain. That's your body's way of preparing you for a perceived threat by triggering your instinctive fight, flight, freeze response, which is great when you're being chased by a hungry hippopotamus, but not so much when you're standing in the supermarket feeling stressed because they've moved all the stock around for the 14th time that month. Finding techniques to manage that anxious energy can help you to feel more in control and reduce the power that those feelings have over you. So how do you do that? What are some simple ways that you can deal with anxiety? Well, that's a great question that I answer in this video, where I talk about 8 ways you can manage anxiety. And you'll find even more advice on managing your well-being in my weekly podcast, Let's Talk About Mental Health. It's linked in the description below. Thanks so much for joining me today. Take care and talk to you next time.